The Lancet is a weekly peer-reviewed general medical journal. It is among the world's oldest and best-known general medical journals. It was founded in 1823 by Thomas Barclay, an English surgeon who named it after the surgical instrument called a lancet. The journal publishes original research articles, review articles, editorials, book reviews, correspondence, as well as news features and case reports. The Lancet has been owned by Elsevier since 1991, and its editor-in-chief since 1995 is Richard Houghton. The journal has editorial offices in London, New York, and Beijing. According to the journal Citation Reports, the journal has a 2018 impact factor of 59.102, ranking it second after the New England Journal of Medicine in the category Medicine, General and Internal. The Lancet also publishes several specialty journals: the Lancet Neurology, the Lancet Respiratory Medicine, and the Lancet Gastroenterology and Hepatology, and the Lancet HIV have built up strong reputations in their medical specialty. According to the journal Citation Reports, the Lancet Oncology has a 2017 impact factor of 36.421. The Lancet Neurology has 27.144. And the Lancet Infectious Diseases has 25.148. There is also an online website for students entitled The Lancet Student in blog format. Launched in 2007. Prior to 1990, the Lancet had volume numbering that reset every year. Issues in January to June were in volume I, with the rest in volume E. In 1990, the journal moved to a sequential volume numbering scheme, with 2 volumes per year. Volumes were retroactively assigned to the years prior to 1990, with the first issue of 1990 being assigned volume 335, and the last issue of 1989 assigned volume 334. The table of contents listing on Science Direct uses this new numbering scheme. The Lancet has taken a political stand on several important medical and non-medical issues. Recent examples include criticism of the World Health Organization, rejection of the WHO's claims of the efficacy of homeopathy as a therapeutic option, disapproval during the Time Read exhibitions hosted arms industry fairs, a call in 2003 for tobacco to be made illegal, and a call for an independent investigation into the American bombing of a hospital in Afghanistan. In 2015, a December 2003 editorial by the journal, titled, "How Do You Sleep at Night, Mr. Blair?" called for tobacco use to be completely banned in the UK. The Royal College of Physicians rejected their argument. John Britton, chairman of the college's tobacco advisory group, praised the journal for discussing the health problem, but he concluded that a ban on tobacco would be a nightmare. Amanda Sanford, spokesperson for the anti-tobacco group Action on Smoking and Health, stated that criminalizing a behavior 26% of the population commit is ludicrous. She also said, "We can't turn the clock back. If tobacco were banned, we would have 13 million people desperately craving a drug that they would not be able to get." The deputy editor of The Lancet responded to the criticism by arguing that no other measures, besides a total ban, would likely be able to reduce tobacco use. The smokers' rights group Forest stated that the editorial gave them amusement and disbelief. Director Simon Clark called the journal fascist and argued that it is hypocritical to ban tobacco while allowing unhealthy junk foods, alcohol consumption, and participation in extreme sports. Health Secretary John Reid reiterated that his government was committed to helping people give up smoking. He added, "Despite the fact that this is a serious problem, it is a little bit extreme for us in Britain to start locking people up because they have an ounce of tobacco somewhere." The Lancet also published an estimate of the Iraq War's Iraqi death toll, around 100,000, in 2004. In 2006, a follow-up study by the same team suggested that the violent death rate in Iraq was not only consistent with the earlier estimate, but had increased considerably in the intervening period. The second survey estimated that there had been 654,965 excess Iraqi deaths as a consequence of the war. The 95% confidence interval was 392,979 to 942,636. 1,849 households that contained 12,801 people were surveyed. The estimates provided in the second article are much higher than those published in other surveys from the same time. Most notably, the Iraq Family Health Survey, published in the New England Journal of Medicine, surveyed 9,345 households across Iraq and estimated 151,000 deaths due to violence over the same period covered in the second Lancet survey by Burnham et al. The NEJM article stated that the second Lancet survey considerably overestimated the number of violent deaths and said the Lancet results were highly improbable, given the internal and external consistency of the data and the much larger sample size and quality control measures taken in the implementation of the IFHS. In August 2014 and during the 2014 Israel-Gaza conflict, the Lancet p.